Hi friends, this is Dr. Abdequaem, Chimthanawala. Today I would like to take a very indifferent topic for prescription. Therapeutics of palpitation. Yes, only palpitation. I have seen in lot of remedies the palpitation part has been described very beautifully, but when we take a case we hardly see the symptoms of palpitation because we are more into taking the history and taking the mental symptoms and then classifying the mental symptoms. But I found few drugs very useful in symptoms only related to palpitation. So whichever the drugs I will take today for palpitation, I'll only take the drugs which have symptoms of palpitation in it and not any other symptoms of that drug. For example, to start with, I would like to start with Aurum metallicum. As you all know, Aurum metallicum is a deep-seated polycrest drug, but its symptoms of palpitations are very important. I have seen in Aurum met, the patient suffers from violent palpitation with anxiety. Now this is how you differentiate the palpitation of Aurum metallicum. In Aurum metallicum, there is congestion of blood in the head and in the chest. मतलब पेशेंट को लगता है कि पूरा ब्लड मेरे सर में चले गया और मेरे छाती में आ गया. There is congestion of blood in the head and in the chest. But when the modality of Aurum metallicum is very important, and that is on least exertion, or you can say after exertion also. So patient will tell डॉक्टर साहब जब भी बहुत मेहनत का काम करता हूँ, जब भी बहुत फास्ट चलता हूँ या जॉगिंग करता हूँ या एक्सरसाइज करता हूँ तो सडनली मेरे को हेडेक होना शुरू हो जाता है. एंड दैट्स अ साइन where the patient needs Aurum met with palpitation. So there is congestion or rush of blood to the head and the chest during or after exertion, especially after exertion. How the pulse are feeble, rapid and irregular. So if the patient is complaining of the rush of blood to the head and the chest, you can see the visible beating of the carotid and the temporal arteries. Now this will identify Aurum met in your OPD. There is a visible beating of the carotid and the temporal artery, and that patient is of Aurum metallicum. Because whenever this symptom the patient is telling you, डॉक्टर साहब मुझे ठक 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 समन हेडेक हो रहा है, ये आर्टरी बेच हलती रहती दिखती है ऐसी, normally we think about belladonna and gluonine. Because we never think Aurum met, because we have already made our mind that Aurum met is a polycrest drug, it must have suicidal thought, it must have the mental symptom. But my friends, it is a very important drug when there is visible beating of the carotid and the temporal arteries, and that is Aurum met palpitation. So in a gist, if you want to remember Aurum met, violent palpitation, anxiety, there is rush of blood to the head and the chest with visible beating of the temporal and the carotid arteries. Compare it with gluonine and belladonna, and if it is Aurum metallicum case, you will be surprised to see the action. It's like magic. One dose Aurum met 1m in a case where I failed in belladonna, where I failed in gluonine, it gave me result in within hours. The patient is better in the evening only. Morning he comes to your body, in the evening he feels better, much better, and then he will tell you that now I exercise, now I do walking, now I do jogging, and there is no headache. That is the magic of homeopathy, and that is the magic of the drug Aurum metallicum. Next drug, Cactus grandiflorus. Now we have seen the heart symptoms of Cactus grandiflorus. Now we'll see symptoms of palpitation. In Cactus grandiflorus, the patient suffers from palpitation day and night. In Aurum met, palpitation after exertion. But in Cactus grandiflorus, palpitation is day and night, and it is aggravated or worse when he walking. Whenever the patient walks, he gets palpitation. Exertion, Aurum metallicum. Now you have to differentiate between walking and exertion. So walking basically is Cactus grandiflorus, and the most important symptom modality of Cactus is aggravation when lying on the left side. Whenever the patient lies on the left side, he gets more palpitation, very similar to lachesis. So aggravation or worse when walking, lying on left side, and at the approach of menses. Just before the menses comes, the cactus patient, the lady will say, डॉक्टर साहब जब ये पीरियड आने पहले में जो घबराहट होती है वो दिल धड़कता है बोले मेरा. That means she is telling you about cactus grandiflorus. So only concentrate on palpitation now. Cactus grandiflorus, palpitation, day and night. Aggravation, walking. Aggravation, lying on left side. And aggravation just before the approach of menses. Only palpitation symptom. A very wonderful remedy. You must prescribe once if you get the case, and you will see miraculous results. Cactus grandiflorus. Next drug, calcarea ars. Now in calcarea ars, it's a 3-line symptom, black letter symptom. Slightest emotions causes palpitation of the heart. I had a case where the wife had lost her husband, but she said, डॉक्टर साहब जब भी मेरे हस्बैंड की याद आती ना मेरे को घबराहट शुरू हो जाती, मेरे को palpitation होना शुरू हो जाता है, तो क्या करूँ बोले. उसके कुछ स्पेसिफिक दवाई तो बोले ताकि मुझे घबराहट ना हो. अभी आज 6-7 साल हो गए हस्बैंड जाने बाद, फिर भी जब भी मैं उनके बारे में सोचती हूँ मुझे बहुत घबराहट होना शुरू होती है, palpitation होना शुरू हो जाता है. क्या दवाई देना चाहिए? I gave this lady calcarea ars 1M, and gradually all her symptoms were better. She remembered her husband still, but the symptom, the body has no symptom of palpitation. We can't wipe out the memory of death of the husband, but the violent palpitation which was caused by the emotion is much better in that lady. So in calcarea ars you must remember slightest emotions causes palpitation of the heart. Now for this you must always remember one more drug, and that is lithium carb. Lithium carb also has the same symptom, that slightest emotions causes palpitation of the heart. And you must remember also one more symptom of calcarea ars, that is palpitation from least exertion. थोड़ा भी पेशेंट चल के आता है उसको palpitation, उसमें लिखा है from least exertion, and that is important. Palpitation from least exertion. So my friends, this is something about palpitation, few remedies. In next video I'll add few. Thank you.